The World Health Organization says the surge in new COVID-19 cases is very concerning, but stops short of calling it a pandemic.
Our decision about whether to use the word pandemic to describe an epidemic is based on an ongoing assessment of the geographical spread of the virus, the severity of disease it causes, and the impact it has on the whole society. Does this virus have pandemic potential? Absolutely it has. Are we there yet? From our assessment, not yet.
The WHO chief explains using the word pandemic will ignite unnecessary fear and that the virus can still be contained. And when asked about the high death toll in Iran, the WHO's Emergencies Program Director cautioned that in the early stage of a country's outbreak, deaths could be overrepresented as compared to cases, as infections are more difficult to detect.
Lucy Hough joins us now from Brussels for more on this. Lucy, what exactly needs to happen for the WHO to classify the outbreak as a pandemic?
Well, as you were hearing there, the WHO is clearly monitoring this situation incredibly closely, and for them to declare the coronavirus, the COVID-19 virus, as a pandemic, it would need to see evidence of an uncontained global spread, an increase in the number of deaths from COVID-19, as well as an increase in the number of severe cases reported around the world. As you were hearing there from the WHO Director General, they are not satisfied that at the moment the virus meets those criteria, but however, they do say that the coronavirus has the potential to be a pandemic. Of course, they are watching the situation in South Korea and Italy, particularly calling the situations in those countries deeply concerning. However, calling the virus a pandemic at this stage, the WHO says could cause panic and may not necessarily lead to a containment of the virus.
Lucy, you know, with over 200 cases in Italy, are authorities in Europe taking special precautions, especially with the Schengen area?
Yes, there is a meeting taking place in Rome in Italy this afternoon in a couple of hours' time, attended by EU health ministers from neighbouring countries, including Italy, Austria and Switzerland, to talk about any future measures to contain the outbreak, particularly in that northern region of Italy in Lombardy. It has been the highest number of cases reported outside of Asia. The seventh death reported in the last 24 hours, which is of clear concern to Europe. So EU health ministers will be discussing what can be done to make sure that the virus doesn't further spread to neighbouring countries. But no indication that there will be any travel restrictions imposed within the Schengen zone at the moment, despite calls from some countries that those should be put in place. But the EU has also announced emergency funding of 230 million euros to be given to the WHO to help it in the fight against the COVID-19 coronavirus.
Thanks for the update, Lucy Hough, speaking to us from Brussels.